We're joined today by Dr. Elizabeth Mack, Associate Professor and Critical Care Physician at the Medical University of South Carolina. Thank you so much for taking time to stop by.
Yeah, thank you for having me.
Absolutely. So one of the big things, and we're seeing it in the news and more often, heat stroke, especially this time of year. What advice would you give people to look out for, or is there even a particular temperature where people should start paying attention?
Sure. So great question. Obviously can be particularly dangerous and even deadly. So something to pay a lot of attention to. So temperature-wise, it really depends on the combination of the temperature and the humidity. So the temperature might not be too hot, it might not even be sunny, but the humidity might be high, and that really might put people at risk. If you're starting to sweat and feeling hot, then you're at risk.
Right.
Yeah, absolutely. So just using that sort of just test yourself.
Right. And both of us are somewhat local here, so the humidity here is always through the roof. So that can even be in the 80s.
Absolutely.
Sometimes people, I think, usually look for it to be in the 90s or over 100, but
Absolutely.
It can happen even earlier.
Absolutely. And if you can, stay covered out of the sun, that's even more important. If you can kind of relocate your work to somewhere that's covered or shaded or something
Right.
like that, that would be useful.
What about in areas, I spent a good deal of time in Las Vegas where you really don't sweat, and it kind of, is that where you find that it catches most people off guard?
Yeah, so actually one interesting thing about heat stroke is that one sign of heat stroke is that if you stop sweating. So, it might not be hot enough or humid enough for you to even start sweating, but if you're hot, starting to actually even get confused, lightheaded, headache, dizzy, any of that, and then you notice that you've stopped sweating, your mouth is dry, your skin is dry, maybe you're not urinating as frequently, that is one huge sign. So be on the lookout for that. If you're hot, if you feel hot and you're not sweating, be cautious.
Right, and I think I know it was definitely the case with me. You're so focused on your work that you're not paying
Absolutely.
attention to that. And for me, it would just be as soon as I would get like little cramps, and then then it would click with me, and then I'd realize my mouth is dry, and then it's like I need to stop and
and hydrate. Exactly.
Right.
So I know it sounds crazy, but the recommendation is actually 8 ounces every 15 to 20 minutes. Not more than 48 ounces an hour, because you can actually get sick from too much water.
Right.
And then if it's been a couple hours and you're still in the heat, then actually starting to work in that sports drinks with electrolytes to replace the salt you're losing with the sweat.
A good point. So are any better than others as far as?
Even the generic is fine, just
Right.
some sort of sports drink that's balanced. And you can even use the packets just in your regular water. It doesn't have to be the pre-mixed fancy stuff.
And if you feel like you're becoming dehydrated or you're working with someone, what are some of the steps that should be taken immediately?
Absolutely. If you start to feel lightheaded, dizzy, like you're about to lose consciousness, or even hopefully you notice it before then, or if you notice a coworker that's passed out or getting overheated, immediately getting them out of the heat, calling for help, 911.
Right.
This isn't a life-threatening emergency. And then getting them out of the heat, fans, some cool water on the face to just cool them down as quickly as you can.
Right. It's definitely not something where you want to let your ego and your macho, come into play, because even earlier this week, I read a report about a mail carrier out in California. They're linking her possible death to the heat. So it's definitely something that people shouldn't toy around with.
Absolutely not. We see deaths from heat stroke, so don't be a victim. Protect yourself and look out for the warning signs.
Yeah, and especially if you're dealing with a coworker, I know that you're not necessarily in the best frame of mind to make decisions
Absolutely.
for yourself. So it's important that you kind of, I guess, push that point home and
absolutely
better to be
for them.
Right. Better safe than sorry.
Yep.
All right. Perfect. Well, thank you so much for taking your time, stopping by, and hopefully we'll get you back in to cover some more topics.
All right. Thank you so much.
All right,